kind of like ease into it.
Ease into it. Okay. Start talking. What do you mean start talking? Like Joe Rogan?
Like what we're doing now.
Oh.
Yeah.
Oh, okay.
Anyway.
I'm David.
And I'm Matthew. And I'm not saying I'm on benzodiazepines because I just started work and I don't want to get drug tested.
Okay. Fair enough.
And you're David.
I'm David.
And I'm Matthew. Or Matt.
Or Matt.
Whatever they call
This is the Handoff Report.
And
podcast.
This is a podcast.
Yes,
yeah.
this is a podcast about the cool stuff nurses learn in nursing school.
You said that really weird.
Sorry. This is a podcast for people who know or like they're interested in nursing stuff, or they don't know they're interested in nursing stuff.
Maybe they've seen that TV show Nurses.
Yep. Oh, God, don't get me started.
It was... Anyway, we're not going to talk about that.
No.
We don't need to talk about that.
Rest assured, if you want what nursing's really like,
just ask
like
us.
how many times have people brought up Grey's Anatomy to you in the hospital?
I keep telling people it's not Grey's Anatomy, it's Scrubs.
It's Scrubs!
That's what a hospital's like.
Yeah. It totally is. But anyway, today we're going to talk about how nursing school works. If you're listening to this podcast, you're probably somewhat interested in the world of nursing.
I'd hope so.
Maybe you want to go to nursing school, but you don't know how to apply or how it works. Or maybe you are in nursing school and you just really could use someone explaining to you the big picture.
Right,
which would
the
be
30,000.
Really...
We're not going to go through the application process. I just want to make that really clear.
No.
We're not doing that. Open up a Word doc or watch one of those YouTube videos and you can find out for yourself.
Oh, geez. Well, no, that's my problem with nursing, with YouTube videos about how nursing school works is...
They're always sponsored by Figs. Have you noticed that? And it's always like 15% off if you use my...
Yeah, or Roman.
Yeah, I'm like... Well, I'm like, great. So instead of paying, $600 for a pair of scrubs, I'm going to pay
They're always
I don't know
these,
what 15% of
always these
600 is. I don't...
It's always these hoity-toity, 20-something-year-olds who just have everything together in their lives, and I don't like that. I don't like someone like that explaining to me how nursing school works.
Well, it's just not really like that,
No.
We don't all have those TikTok lights.
It's like, yes, and
they don't follow us around.
I passed the NCLEX in 75 questions, and now I work in the NICU, and it's just great.
NICU's kind of cool, though.
NICU's kind of cool. It's just so perfect.
And you don't want perfect.
Can you fully trust someone?
Well,
like
mean, that's why you work in an ER.
Yeah, well. Oh yeah, we should introduce ourselves. Besides just our names, why should I listen to these two guys talk about nursing?
Probably shouldn't, but
I know for a fact you shouldn't. But we both just graduated.
Right. We did. In May. This past May.
Yeah. With a Bachelor's of Science in Nursing.
Yeah.
And then
BSN.
a mere 20 days later, we took our NCLEX exams and passed.
We did.
That was the greatest feeling ever, is finally having that precious, precious license. I'm not being facetious or sarcastic. That thing is your baby. And I think that's something they taught well in nursing school.
Oh yeah, protect your license.
Oh jeez.
Let it grow up. I mean, you're responsible for it. You have to feed it.
You have to water it.
Yeah, make sure it goes to school and one day send it off to some overpriced college like Baylor. But that's just all colleges,
That's all colleges. Anyway, we're about to just explain.
I didn't say where I worked.
Oh, sorry. You're just super sketchy about it.
Dude, I teed you up and I was like, you work in an ER. And you're like, so anyway, let's talk about nursing.
So where do you work then?
I work on a children's floor at a children's hospital, on a surgery floor. Not the OR or the pre-op or PACU.
Yeah, lest you think he's some kind of wussy nurse that works in the OR.
No, they're all great, but that's more of a setting out to pasture type of thing. I feel like
where nurses go to die.
Or retire.
Retire. is
Whatever
what I meant.
happens first, I guess.
Oh no. I wanted to be an OR nurse at first,
I know you did.
but I quickly realized that's not where you go to start a career. It's where you go to end a good career.
Yeah, exactly.
And it's
Or PACU. PACU's great, though. I love
PACU.
PACU.
PACU's great.
Want to go to PACU.
So Matthew's patients are, pediatric kids with appendicitis or maybe different like respiratory,
Heart caths.
Mhm.
Basically anything surgical.
where they have to stay at a hospital to be monitored because of the extent of the surgery.
What were we talking about?
We're about to explain what nursing school is like
Oh, okay.
from our limited yet
Extensive.
gospel perspective. Limited yet extensive perspective.
Obviously, you should listen to the new grads.
Yes, because we have it fresh on the brain.
Exactly.
We won't be passionate about this for much longer. Anyway, this is gonna be a lot, but no, yeah. If you're interested in nursing school, this will be very helpful, and that's kind of our goal, is to kind of give you a broad view of what to expect. That's not coming from a pie in the sky kind of like, it's challenging, but it's rewarding.
It's not coming from like a school or hospital recruiter, in other words.
Yes. So the first thing to clarify, please do not assume that if it's more expensive, it's a better program.
Oh, no.
This is not like getting a law degree or a political science degree, I think, which maybe is more like that.
Yeah.
I don't know. But in nursing, it does not really matter in terms of like the price, what you get out of the degree. You need to find an affordable program because it'll get you to sit for the same exam and be eligible for the same jobs. These hospitals do not give a rip what school you went to. Or even your grades.
Well, especially not for entry-level stuff, which is what you're going to be doing anyway.
Yeah.
Hopefully.
So yeah, don't worry about that. Just go to a school with a fantastic pass rate.
Yeah.
Which, that's important.
Yeah.
The school's job is to prepare you to take the state board's exams. Primarily. Their second job is to prepare you for the working environment. And not every school does that well. But that's also kind of up to you as the student. You have to really make the most of it and not just expect the school to do everything for you.
Yeah, you got to risk looking stupid.
Ugh, yes. No, that is one of your mottos.
Yeah.
Yeah.
That's what I told my preceptor.
I'm not afraid to look stupid.
I'm not afraid to look stupid. I'll try it.
Yeah.
I'm also drinking out of a mason jar right now. Drinking water.
Water.
It's water.
It's water. Moving on.
Where'd you get that flush over there? That saline flush? Is that yours?
You know where I got it. I got it from the hospital. We're constantly stealing stuff from the hospital.
We?
We? There's no we.
Don't.
In saline
Don't
flush.
snitch me.
Well, we're going to walk you through what it's like to get a bachelor's degree in nursing, just because that's our experience. First off, prerequisite courses.
Just do it at a community college. I mean, like, don't overthink it. I don't know why everyone, what do you ask for? Like, they went to school before nursing school. If they went to a community college, they'll look down and say it with like shame that, oh, I went to a community college.
Oh yeah, well,
it's dumb.
Yeah, I didn't even get a degree before nursing school. Our nursing school is 2 years.
I had an associate's in arts degree and an associate's of science degree, both by accident.
Our nursing program required 60 credits. 60 credits from like approved classes or something.
I think it was 61. 61 credits.
Or maybe 51.
Was it 51? It was
61. And so
I was just messing with you. I don't know if it's 61.
And so your prerequisite courses, again, it just does not matter where you get these. You don't even have to get a degree, which is something I took advantage of.
I didn't.
Just get the credits so you can apply. Be strategic about how you take these classes because there are some classes you need to have a grade, before you apply, and there are some like U.S. history too. You don't need to have that grade back in order to apply. And so to make yourself competitive, you have to get straight A's in math and sciences.
Yes.
I really think that's where it.
You can get a few
They look
Bs.
They look at that differently.
Well, I mean, you can get a few Bs.
Your
but
GPA might be 3.2, but if your math and sciences is 4.0, they don't care if you got an F in U.S. history.
Well, they're gonna.
It's cause for pause.
They might ponder that for a moment.
It's gonna take I'm gonna have to sip on wine to go through this application.
Well, it does seem like some of them are drinking something when they're doing the application processes.
Oh, jeez.
Anyway,
I had a classmate who got a bachelor's in Texas A&M, but then decided to do the traditional track. Because at our nursing school, you can do it traditional, meaning in 4 semesters.
I know
in
that
2
person.
years. Or if you have a bachelor's degree already, you can go through the accelerated track. Because to get a bachelor's in Texas, there's some courses that overlaps, and the school found a way to teach it in an abbreviated way, where it's still 4 or 5 semesters, but in only 1.5 years, not the full 2. But anyway, I would recommend doing it at a community college. Usually, the education is not as good. I'll just say, I think the education's not as good. It doesn't have to be. My motto is college is what you make of it. Like, it does not matter who the teacher is. You're going to get out what you put in.
Yeah, that's fair.
If you put in the money and the time, you're going to get out the education no matter how good or bad the teacher is.
Oh,
There are teachers that are bad enough to really just make it miserable for you. I acknowledge that, but
I mean, have you seen those free videos of like Harvard that they put up?
Well,
like education is free.
Now, let me tell you something. I had a classmate who, if you didn't notice already, I have a lot of classmates. I have a classmate who got accepted to a nursing program in Kerrville that, like, after her first semester, the class got either canceled or, like, the program got dismantled or unaccredited.
Oh.
So she had to start nursing school all over again in San Antonio.
Yikes.
Yeah, that's what I mean. Like, schools can definitely be dumb, but if you do it in a community college, you save so much more money than going to A&M for 4 years.
Oh yeah. Why A&M? What's
She probably, a lot of folks don't know they want to be nurses so early. Like, a lot of them decided to be nurses when they finished their business degrees or something like that. Or a lot of them decide they want to be nurses after they've like gotten a degree in psychology.
No, I just meant like why specifically A&M?
Oh, why specifically A&M? Because that's where my classmate went.
Oh, okay.
Yeah.
Okay, I thought you were making a comment about like
No, I'm not. I'm
sort
not.
of like
I'm
the
not here dissing on schools.
cultish
Matthew.
aspect of A&M.
Well, yes. Applying to a nursing program.
Yeah.
When I did it, there was no video interview. There was a standardized test called the TEAS.
The T's.
Yeah, the TEAS. TEAS.
No E.
It was like, it's like college readiness, but not like the SAT.
No.
Not like the SAT at all. The SAT is like the SAT is not like how much you know. It tests whether you know how to take a test.
Yeah, like critical thinking.
But the TEAS does test if you know enough to not like be just flailing and gasping for air when you start college.
It's more science bend to it.
It is.
The
Yeah,
TEAS.
it does have a science bent. The TEAS test I took had a little bit of math, a little bit of reading, and then very basic anatomy and physiology questions. It did not have like, what's the life cycle of a centipede kind of questions. It had like, what are the 4 chambers of the heart? And
not a lot of like David Attenborough.
And here we find the rhinoceros. It's natural. Is that David Attenborough?
Yeah, that's how I studied.
Is that how you studied?
Yeah, nursing squad put him on and then study.
Man.
He got the job done.
Apparently. So there's entrance exams. There's short answer essays to write about why you want to be a nurse. And I hated those because like no one really ever knows why they want to be a nurse until like they're finally faced with what nursing is actually like.
And you sound so corny writing them too, where you're like
I have to brag about myself and like make up stuff about nursing.
yeah, like my whole life has like come to this point and I'm like ready to.
But yeah, just get through it, do a good job.
Don't have your dog barking when you're doing the video interview.
Right. I think really make sure to have good grades to get in.
Yeah, that's something
competitive.
yeah.
I think it matters more to do really well on the TEAS test, because you don't have to you don't have to be just academically spectacular, but if you score in the 90s on the TEAS test, they'll take you.
You don't need to be a world stopper. You just need to.
Also helps to be a dude, because I think there's a little bit of affirmative action happening in that area.
Yeah, I can now say I know what it feels like to be a woman in like a STEM major.
Oh yeah, well,
Anything other than nursing.
we have plenty to talk about where what it's like to be a guy in a female-dominated profession.
It's not bad.
It's not bad.
Just different.
Yeah. So maybe by God's grace, you finally get into nursing school. That's a huge accomplishment.
Oh yeah.
Congratulations to those of you who have already. Now the hell begins. Let's go through the curriculum semester by semester. What do you think?
Yes.
Okay. So basically, the first 2 semesters make you an LVN.
Right.
And the last 2 semesters are what make you a registered nurse.
Yes.
All those like very meta bird's eye view, like this is how you care for patients, plural. The first few semesters is where you learn all the little skills.
Right. How to start an IV on like a leak or something.
Yeah. Our school had sophisticated dummies, but I think it was a tad overhyped.
What,
But
the dummies?
I think the simulation center in general. Okay, it was more impressive as school got along, because they saved the good dummies for the more advanced students. We'll talk about that. And in first semester, you take fundamentals of nursing, concepts of professional nursing, pathophysiology, and health assessment. And this is pretty standard, actually. The names will sound super similar to this. Later on, it doesn't sound that similar.
Right.
Fundamentals of nursing are where you learn the basics of patient safety.
Isn't that something?
It'll be things about like how to prevent basic injuries, how to take vital signs, maybe the signs and symptoms of dehydration and malnutrition. These are all like,
yeah,
this
drink
is
some
also
water, people.
If you just had to take care of a person, where to start? That's fundamentals of nursing. Whereas concepts of professional nursing, it's really in the name. Professional nursing, they really drive home that nursing is not a job, it's a profession. And I thought that was a very neat distinction. You know, I used to be a barista, you know, at Starbucks. That's a job, right? I never fully realized what it meant to be a professional until they explained it to me in nursing school. They teach you about how you have to be part of a nursing organization, and you have to read up on literature, and you have to have a license, and you have to keep it up with more education every 2 years, and you reapply. Like a doctor will have their practice. Nursing has their practice, their kind of little bubble of where they do their nursing, and they're accountable to the law and to other healthcare professionals. That's what makes you a professional.
That's something I didn't really know going in as well.
Me neither.
That there was like a whole world of that.
And yeah, but concepts sucked as a class.
It's hard to teach.
Okay, so in concepts, all the stuff you learn in concepts, you just don't understand until you take leadership and management your last semester.
Well, you don't have any hospital experience.
Exactly.
You're going and learning about all these concepts, and you're like, I don't really know how this applies to anything, but let me get up at 5 in the morning to take an exam.
It's really hard to just teach a bunch of stuff with no application in a very hands-on profession like nursing. You learn about the professional, legal, and ethical responsibilities of nursing. It's a class about what it means to be a professional. It seems stupid as you take it, but all the content gets revisited in the last semester, and that's when it started to click for me. Like you said, because of the hospital experience. Another one is health assessment.
This is the fun one.
Oh yeah. This is the one you need to have, like, enjoy it before your life gets worse and worse and worse from there. Because this is a really fun class. You need to know how to recognize when something is wrong.
Right. So they teach you normal, so you can recognize not normal.
Yeah, and then they teach you all the different ways to describe what is not normal, so that everyone kind of is on the same page. Like a scar will be different than a lesion. You can't like use those two words interchangeably. And then there are standardized ways to describe how much your leg is swelling, for example. If it goes in 1 or 2 centimeters, there's verbiage to it that you learn in health assessment, like +1.
There you go.
+1 pitting edema.
Haven't lost everything.
+4 pitting edema. +4 being deeper. You get to learn where to put the stethoscope on your chest to know what the different heart sounds are. And then at the very end, you have to do what's called a head-to-toe assessment. One of the most nerve-wracking
It was pretty
things.
brutal.
Yeah. It's you have to get it done in less than 36 minutes. And
What was your time for that?
heck, I don't remember.
I
think mine was 30-something minutes.
30-something.
And if you did it in over 45, you didn't pass.
Man.
That's what I remember. A head-to-toe assessment, and you have to talk out loud while you're doing it. That was the worst part. I can assess somebody head-to-toe.
It's not like out loud.
Not out
saying,
loud.
I'm doing this
And
now.
now I'm palpating the scalp for bumps and lesions. And now I'm palpating the supraclavicular lymph nodes.
For bumps and lesions.
Yes. Oh, jeez.
Mine was swelling and redness.
Swelling and redness.
Everything was swelling and redness. Someone came out to me the other day and had me palpate their lymph nodes in their neck.
Oh, I palpate lymph nodes all the time.
Oh, you do?
Oh, yeah.
Huh. I do that sometimes.
In the ER, this guy came in with an abscess in front of his right ear. It was this big bump, and I was like, well, the doctor's not here yet, and my nurse hasn't gotten to assess this person, so I'm going to do some digging.
Yeah, like take a poke at it.
So I touched it and asked if it hurt, because if there's a bump that doesn't hurt, then it's time to start asking the question, do you have cancer?
Did it hurt?
It did hurt.
That's good.
It's good. But then I start feeling around for whether there's a cluster of swollen lymph nodes and that one's like the biggest or something. And no, I checked his lymph nodes and it was all good. It turned out to be just one of the worst zits I had ever seen. And the doctor squeezed it out.
You didn't see me in high school.
No. Okay, last but not least, the dreaded pathophysiology class.
See, I don't know about this one. You say dreaded.
I say dreaded.
I took it. I didn't think it was all that bad.
I think you killed your first semester.
It was all downhill from there.
But patho is just where it's short for pathophysiology. When you take anatomy and physiology, anatomy is how the body is structured, how the body is built, and physiology is how it functions, right? The heart has 4 chambers. That's its anatomy.
I thought it had 6.
We're not talking about cows, Matthew. We're talking about
Cows have 6 stomachs, not hearts.
This is why I'm not a veterinarian. No, the heart has 4 chambers, and that's its anatomy. But the heart pumps by like contracting smooth muscle, and that's its physiology. So pathophysiology, just putting that word patho in front of it means, how does getting sick work? It's all about the really nitty-gritty science behind getting sick.
So it's bad work. How does bad work?
Right. And so this is all stuff you need to know. There is nothing in that class that's like, oh, I don't need to know that.
Well, if you don't know it, it'll hunt you down and kill you.
I know, yeah. Like
with a
I Am
sharpened
Legend.
stick.
It's like I Am Legend. Just imagine those zombies running after you. And,
First it'll kill your dog.
Yes.
And then it'll kill you.
oh, goodness. It took me to a dark place of sadness.
Mm.
I miss that dog. He was a good boy.
Did he turn into a zombie at the end of that? I can't remember. It's been a while.
I didn't finish it. Don't spoil it.
Oh.
But I did get to the part where the dog died, so good thing you didn't. Anyway, you learn about what leads to diabetes. You don't learn about diabetes, for example. You learn about what leads to it, which is, pathophysiology gets down to the nitty gritty, deep down, like, okay, no, these are the cells in your pancreas that stop working.
Right.
And this is what it can lead to. If you have chronic high blood sugar, these are the cells that it's going to hit first in your body and start causing damage. But so you're not learning anything about treatment. Nothing about treatment. You're just learning about how stuff goes wrong. You'll learn about how the stress response, which we'll do an episode about. It's super cool just how when you're stressed, your body will like start shooting off this cocktail of stress hormones that will elevate your blood sugar and heart rate to do the fight or flight response. And I just remember all my classmates being like, I really wish I knew about how stress worked before
starting nursing school.
Exactly, because by that point you're already like, oh my goodness.
It did age people. That's for sure. It's great. It's awesome.
It's great. Yeah,
you should do it.
It's rewarding.
Come on in. The water's great.
We have cookies. Anyway, so look, you learn about what leads to heart failure, dementia, stress, all the different things, so that later you
dementia. I'd forgotten about that one.
Well, dementia is a degenerative neurocognitive disorder.
Thanks, Dr. Encyclopedia.
You need to pay attention. I thought
it was a joke.
Oh. I often mistake jokes for an opportunity for me to flex. Second semester.
Oh, it's a kick in the pants.
Yes.
That's when my coffee addiction started.
This point in the program is the weirdest and roughest because the students are not really ready to learn about how to manage all the complex care of adults with chronic diseases. So they teach them 2 nursing areas that are like an introduction to management of patient care. And then they also teach pharmacology, which is the study of medications and how they work in the body. So this is all supposed to prepare you for the big 2 classes in 3rd semester, Adult 1 and Adult 2.
Which is coincidentally what most of your boards are going to be on.
Yes, like 90%.
That's like all the questions on NCLEX.
Yeah. I guess as a way of preparing you for that, they teach you psychiatric nursing, and maternal newborn nursing. Those are the 2 fields that they kind of throw in there early to, I guess, introduce you to the hospital setting through clinicals.
Right.
Let's start with psych, because psych class is great. It was not taught well for me. It wasn't taught well for me, but the stuff you learn in psych, you use everywhere. You learn about depression and schizophrenia and anxiety and how to treat that stuff, but also how to deal with patients who have depression, anxiety, bipolar, on top of whatever their illness might already be.
Right, because it's not about medicating. Yeah. It's about like doing the other steps before having to medicate, like doing it in like a least invasive way.
The biggest thing you learn about, my opinion, is therapeutic communication. Something called therapeutic communication. It's the strategy of talking where the things you say are the least antagonistic and the most conducive to healing. Someone will have diabetes, but on top of that, they might have like a lot of anxiety about a new diagnosis. And maybe they're not diagnosed with anxiety, but they have all the signs and symptoms of anxiety. And so psych class is great because you're equipped with all the tools necessary to like prevent people from panicking or prevent things from getting worse psychologically.
That was the biggest thing, because for me, when I was going through psych class, I knew really early on that I didn't want to be a psych nurse.
Right.
So I was kind of like, well, I don't know if I really have to pay attention here. And it was crazy how much, like, if you're a nurse, you deal with psych.
No matter where you go.
It's everywhere. Mm-hmm. So you need to know how to use that. Mm-hmm. I mean, you use the meds, you use the communication techniques, like it's there. So when you're taking it, pay attention.
Most of the coolest stories in the ER are because of psych. I really appreciate psych because you get a lot of psych patients in the ER, or you get a lot of patients in the ER who, on top of a UTI, they also have like really bad bipolar, and then they're super aggressive. They start fighting everybody. You're like asking the doctor over and over again for the haloperidol to sedate them, and then they'll give you like an insultingly small dose.
Just crumbs under the table.
No, yeah, I had a patient who kept using the call light and over and over again. And then she kept saying we were all devils and was trying to escape from the bed. So yeah, we asked for haloperidol and the doctor prescribed like 2 milligrams.
Oh,
And
honey.
all like 8 nurses there looked at each other and started laughing. Like, this is not going to do anything. And because they're experienced. Anyway, unlike psych, maternal newborn sucks because it's a class about knowledge that most of the class will never use again.
Well, hang on there for a second. Because when you deal with kids, you do use it. Within pediatrics.
But kids are not pregnant mothers.
But sometimes I'll get babies.
Okay.
The bebe. Sometimes I get bebes. So I like those things they talk about become important. Like I still hear like meconium from time to time.
Okay.
Like whispered within the halls. But it sucks being
But do you do APGAR scores?
Oh, please, no.
Psych, you said something earlier about how you knew you didn't want to be a psych nurse.
Right.
A lot of the class knows they're never going to be in postpartum or antepartum or labor and delivery, or they might be in the NICU, right? Or the nursery. Those are all different
I
units.
love the nursery.
The class especially sucks for male students because hospitals most of the time won't hire male nurses for the nursery, labor and delivery, or postpartum. If you're a guy and you want to work in the NICU, then the class is not useless because then you can work in the NICU.
I've seen a few guys work in the NICU, but not a whole lot.
The class is about pregnancy all the way to 4 to 6 weeks after giving birth. There's so much weird stuff to memorize that's not intuitive.
No.
And you're asked to think like critically at such a high level all of a sudden and do all these kind of like multi-step thinking. Like, oh, if the lady is like this far in her gestational age, the baby has the symptoms. What do you do? Why would you do it? That's all a ton of stuff that it's not like they eased you into it from first semester. No, it's hardcore patient management.
It's just new stuff
about something I know I'm not going to use again.
Especially as a dude going in.
Yeah.
I mean,
a lot of classmates though went into maternal newborn.
They did.
So
they really did.
But a lot of, just as many of them know they're not going to do that.
Well, more.
Yeah. A lot of nurses go into nursing school because they want to work with moms and babies, because that's their passion. We're just saying it's a rough class for those who know they can't or won't go into maternal newborn nursing.
I think you either like develop baby fever or it puts you back having a baby like 5 years just because of how brutal it is, you know? Yeah. So mad respect.
Don't be afraid of C-sections. Be afraid of episiotomies.
Should cross-stitch that into a pillow.
Last but not least, pharmacology.
Pharmacology. Definitely not least.
Pharmacology is is the study of medications and how they work in the body. It's systematic. The course tries its best to teach the most commonly used drugs.
They do.
And if you do really well in it, you're going to do really well your third semester when you start taking care of acute or chronic care for adults. But yeah, pharmacology is the most memorization heavy class there is.
It's not intuitive at all.
No.
You just memorize.
Flashcards. You just got to know the names, the side effects, the mechanism of action, or how it works.
Did I tell you when I studied for my final for pharm, I walked like 12 miles and I just had my cheat sheets and I was walking around the neighborhood like a crazy person.
Just reading
them out loud to myself.
Hopefully not during the oral contraceptives chapter.
Oh, definitely during
Oh, you said this is for finals.
And I had those like dumb little like sayings, that would help you memorize
those were the funnest.
And I sound like a crazy person. Good times. Good times.
So after second semester, I just think it's smoother.
Yeah. I think so
I
too.
feel like it's less traumatic with a T. Like it's less traumatic.
Well, I think you're so traumatized during second semester that everything after that, you're kind of just resigned to your fate a little bit.
Because third semester is where two important things happen. One, you realize what field of nursing you want to work in. Third semester is intensely clinical heavy in our program.
It's when the Stockholm syndrome kind of like sets in, you know?
Well, the two things that happened for me was that was when I finally started to feel like a nurse.
Exactly. Yeah. It clicks.
Adult 1 and Adult 2 and Pediatrics. Those are the 3 courses. And all of them had a ton of clinical hours to do. And that was the best part.
Oh, yeah. At the end of it, you feel like you're getting there.
In all 3 of the classes, you feel like you're learning the important stuff. Like, oh, this is where the rubber meets the road. This is what it's all been leading to. I have to start using all this stuff from the first 2 semesters.
You start pulling things.
To treat patients. And then it's so satisfying to treat them. You're really feeling like something and not like you don't feel so stupid anymore.
It's like you're like pulling on all the threads and you're starting to like wrap it all together, you know, like tie it all up. It's coming together third semester.
So different schools call the courses different things at this stage. I know in Austin there's a program where the adult acute illnesses is called acute care and it's done over the summer by itself.
That's neat.
Yeah, that sounds fun. Like going to the ER for clinicals for 10 weeks during the summer, yeah. But for us, it's 2 flex courses back to back. Adult 1 was a 8-week.
Sounds less fun.
It was a very rigorous class format. Exams every single week. So in Adult 1, you learn chronic illnesses. You learn about stuff like diabetes, hypertension, cholesterol. In Adult 2, you learn about acute illnesses like heart attacks, strokes, respiratory distress.
Things that'll kill you quickly.
Right.
Like bears and...
The chronic illness class was mostly just 8 to 10 weeks of just shaming you for how you eat.
I did kind of shape up after that. I'm like, maybe I shouldn't eat the whole, 5-pound bag of animal crackers. I'll just eat half the bag because health is important.
More leafy greens.
Lean meats.
No smoking.
No vaping.
Basically all the stuff like nurses on TV back in the old days are doing. Like they're all around the nurses' station smoking.
It comes full circle. It really does.
Oh, yeah.
There's something ironic about that.
Yeah. By the end of these courses, you get really good at not having to like write out your plan of care for patients in a super step-by-step training wheels kind of way. Now you can look at a patient and in seconds develop a care plan. And it feels amazing. You
nice
feel
having,
like you have superpowers.
You have like a starting place,
Yeah.
where you can base all your stuff off of. And it's really nice having a base like that. You feel less lost.
You feel ready to start actually after this semester. But then 4th semester, you learn all this stuff to kind of prep you for the workplace. It's a bunch of formality stuff. It's a bunch of busy work to get you from school to the workplace. A lot of transitioning.
It's what gets you your bachelor's degree.
It's a semester of transitioning.
In some ways, I'm kind of thankful for that, though. Because it taught me, I guess, different aspects of nursing I wasn't aware of like leadership and interpersonal and interprofessional communication, that kind of stuff.
Delegation, but also stuff like disaster preparedness.
Right. Different avenues of nursing I hadn't really realized
how
were there.
How different ethnic or racial populations struggle differently and think of health differently. And this is all stuff that if a nurse knows, they can be super equipped to treat them. We got to do clinicals at a refugee clinic here in San Antonio, and that was an amazing experience.
That was incredibly rewarding.
We'll talk more about that for sure. But then the mountaintop of the nursing school experience.
Oh, absolutely.
For me,
absolutely.
Is immersion. Immersion is when you work as a nurse for free. For 12 shifts. For 10 shifts.
And you like it.
So basically, based on your grades, in the standardized tests after a third semester. Based on how well you do on those and a couple other factors, they plug you in with a dedicated nurse preceptor at a hospital, and you work their schedule full time.
Yeah,
you're a full-time nurse. You work their schedule for like 4 to 6 weeks. Yeah, that sounds about right.
That sounds about right.
Maybe 4 or 5, depending on if you get a nurse that does 8-hour shifts or 12-hour shifts.
Right. That does factor in.
And so my heart goes out to the classmates that had to do 5 days a week, 8-hour shifts. I think that's rougher than doing 3 days a week, 12-hour shifts.
Especially because you have all that busy work.
You have a ton of classwork left.
Because you're like prepping for NCLEX at the same time. Yeah.
Now, if you're blessed, you get placed in immersion in where you want to work or something similar. Or maybe in an area where you discover that's where you want to work, right? You have to take advantage of that, because the nurse preceptors will let you be lazy and kind of just take care of just one patient, maybe not do as much documentation.
Yeah.
But you're setting yourself up for failure with that.
Right.
You try to be as independent as possible.
That's the time where the school kind of cuts you loose a little bit and says, let's let them go out and stretch a little bit, you know, before they start off their career.
And then bada bing, bada boom. That last shift is over.
Yeah, it goes by fast.
You're back home, and then you're just waiting for graduation at that point. No, you take so another thing that happens your last semester is that you take
like those prep tests.
Yeah, you take a benchmark test that lets you know how ready you are to take the NCLEX. I wonder how accurate that was, because it told me I had a 97. And it told you had like a 98 or 99% chance of passing the NCLEX. And we passed, but I don't know, man.
I mean, I'd say it worked then.
Yeah, and so be encouraged that, you know.
I mean, unless you don't get a good...
unless it's telling you, yeah, you're kind of... No, yeah, so that happens your last semester. What else happens your last semester? It was rough because we did it during COVID.
I think I blacked out most of that.
No, yeah. I think some general tips I'd give now. We'd revisit this later, but apply for jobs early.
Yeah.
Try to get into residency programs early.
Most summer jobs I know, applications started in like January. They started opening stuff up.
You cannot wait till immersion to have applied for.
No.
Units. Heck no. Because that'll set you back. And take the NCLEX as soon as possible.
Please do.
Please do not take it. You have 6 months to take it. Do not take it in the 5th or 4th or even the 2nd month. Like, take it, sign up early, get a nice spot, so that
you're just tempting fate at that point.
Honestly. And you want to, I don't know, maybe this is just me, but have a break, but don't wait too long to get to work, you know, because that knowledge is valuable, and you don't want to have the steepest learning curve ever.
It starts leaking fast, so you want to save as much as you can, get into the workplace so you can have a little bit of a leg up from where you were at immersion.
So that's nursing school for you. I'm super thankful. Super thankful.
Yeah.
And I'm super thankful for how it grew me in terms of character, of how it grew me in terms of compassion for people, how it grew me in terms of being a thinker. Like, it's really neat to use instincts, and then I'll look back and be like, I didn't have those instincts 2 years ago.
It takes more than
just being a people person. You have to have a capacity to shoulder someone's burdens.
I think whatever this feeling we're trying to describe is, I think it's something that most people have when they come out of school, but they tend to lose to some extent.
Burnout is real.
It's something you have to hold on to. You have to keep reminding yourself of why you did it. I think that comes from a place other than yourself.
Well,
that's it, I guess.
And with that, I've been David.
I am Matthew.
And this is the Handoff Report.